Pregnancy due dates may seem completely harmless, but they are causing serious harm to a lot of women. The medical approach to due dates can interfere with the normal hormonal cascade of pregnancy, stall the onset of labour, and lead to a more unpleasant birth experience, and also lead to unnecessary inductions and C-sections. This is really common, I hear it all the time. I'm going to go through what causes the problems, give you an approach to avoid the pitfalls, and also go through some questionable statistics regarding stillbirths, which are often given to mums at around the time of their due dates. So a pregnancy is proceeding well without complications, and mum happily arrives at her due date, on which she attends a routine checkup. At this checkup, a psychological spanner is thrown into the works, and the subsequent hormonal impact may derail mum's progress. The psychological spanner is the discussion that mum is about to be overdue, and therefore needs to start thinking about whether she should have an induction at or soon after 41 weeks. You could argue that it's perfectly reasonable to consider options at this stage, but often what mums report actually feeling is pressure, a deadline. This baby better come out soon, otherwise we are going to medicalise your pregnancy. For many mothers, this causes unnecessary stress and anxiety, and that can lead to a decrease in oxytocin, a key hormone involved in labour. When mothers are told the reasons for considering induction, one of the most commonly cited ones is the increased risk of stillbirth if pregnancy continues too long. More stress, more pressure, less oxytocin. I will come back to those stillbirth statistics later. Stress and pressure can stall the onset of labour. The anxiety of thinking, I must start labour as soon as possible, can actually interfere with its onset. Why is it that nobody ever says, hey, you haven't had a premature birth? That's good, isn't it? Stress shutting down labour makes sense. If you're a hunter-gatherer and there is a pack of hungry wolves encircling your camp, that is not a good time to be going into labour. But when stress is caused by an unnecessary psychological blow from your healthcare provider, that is a serious disservice. Before you know it, you are swept down the medicalisation route, heading towards induction, be it by membrane sweeps, prostaglandin pessaries, artificial rupture of your membranes, or of course the synthetic oxytocin drip, which most people equate with induction. And that means a more medicalised birth with more internal exams, a more stressful hospital environment, no option for a home birth if you're having an oxytocin drip, more monitoring, more difficulty moving around in labour due to the monitoring, more chance of needing an epidural and needing forceps. In general, a less satisfying birth experience with more pain, plus an increased risk of uterine hyperstimulation, fetal distress, heavy bleeding after birth, and uterine rupture. You're also bringing baby out earlier than nature intended, which may have further reaching consequences, and continuing to interfere with oxytocin. Receiving synthetic oxytocin does not have the same effect on the body as having it released from the brain naturally. As well as labour, oxytocin is also involved in breastfeeding and bonding between mother and baby, and synthetic oxytocin does not exert the same important effects on the maternal brain that natural oxytocin does, and may negatively impact neurodevelopment in the baby. This is not a hormone you want to be interfering with if you don't need to. Lots of sources in the description for all these points and for further reading. There is also the increased risk of progressing to C-section. And if you're wondering what the concerns with a C-section are, then definitely check out my video on this topic where I discuss its association with these conditions, link in the description. The statistics on C-section rates in relation to inductions are disputed, but one thing is for sure, inductions are increasing, C-sections are increasing, and the incidence of conditions like these ones have gone up dramatically. And that brings me to stillbirth statistics, because at least your pregnancy didn't go too late and therefore your chance of stillbirth went down, right? Well, when someone is planning to interfere with nature and give you an induction at a point where there is no sign at all that there is anything wrong with your pregnancy, then they should really be giving you very clear reasoning. But what people are often told is that the risk of stillbirth goes up after 42 weeks, with no more detail given. That's pretty useless information. How much is the risk actually going up by? Or maybe equally unhelpfully, women might be told that the risk of stillbirth doubles, which sounds more sinister, but is also pretty unhelpful. Doubles from what, 5% to 10%? No. Doubles from 0.1% at 40 weeks to 0.2% at 43 weeks. Now, your view of those risks is very personal. You might think it's a tiny risk of no significance or a concerning risk given the seriousness of what we are talking about. Your perspective of risk is not something that someone else can determine for you. But the key point is someone really needs to tell you the actual figures for you to have informed consent for any medical procedure. It is interesting that when you look at the data provided by the Office for National Statistics and calculate the incidence of stillbirths by gestational age, looking at the most recent years where those data are available, some of the lowest rates of stillbirths seem to have occurred in women giving birth at or after 42 weeks. The best way to approach these topics in pregnancy is to plan well in advance. Think about induction in early pregnancy. Do your own research on as many aspects as you can and make a plan then. Be prepared for induction to be discussed at your 40-week check, because if it's not a surprise and you've already got a plan, it won't cause stress or anxiety when the topic is brought up. Of course, your plan can change as your pregnancy changes, but you should not be thinking of these things for the very first time at 40 weeks of pregnancy. Pregnancy should not be approached as a medical problem. You haven't had a stroke or a car crash. You do not have to medicalize your pregnancy at all. You do not have to run your pregnancy on a schedule. Due dates are a tool to be used by you if you want to use them. And you do not have to be pressured into an induction. It's your choice. Of course, I have not gone through all the factors involved when it comes to making your decision. This video is not a comprehensive weighing up of both sides. It's just supposed to give you a different perspective that is often lacking and prompt more of your own investigation. If you just leave it to the medical system to deal with, you might find that system has a very different set of priorities than you do for your birth. Also, if you don't want people asking, "Have you had your baby yet?" then don't tell them your due date. Or you could give them a vague time that correlates to around 41, maybe even 42 weeks of pregnancy. If your baby's due date is sometime in late January, for example, you could tell people that you are due around the beginning of February if you feel that eases your pressure. It's entirely up to you. Thanks for watching. I hope you found this information helpful. Please do subscribe, and I'll see you next time.